So for example, I had a client I worked with for 6 months. I've seen her every week for 6 months. And it would be 2 pounds lost one week, 1 pound, back up again. And she had reasons. We can call them excuses, but she had reasons why it was a challenge for her. And one day she just bursted out crying.
Nuwave fam, what's going on? I'm Dr. Cameron Brown.
And I am Dr. Eusebio DeRosier. Welcome to Nuwave TV. For those that are new to the channel and just tuning in, we want to thank you for watching. And we also want to say hello.
Yes, and today's guest, who's been a long-time friend of ours, will be sharing her knowledge and expertise on the effective and sustainable weight loss. She's been seeing great results, and as the young folks call it, patients have been getting snatched. So we'd like to welcome Miss Michelle Hylton.
Yes.
Thank you both for inviting me. It's such a pleasure and an honor. Thank you.
Yes. So, why don't we just start by you telling the viewers a little bit about yourself and your practice?
Okay, so quickly, my name is Miss Michelle Hylton. I'm a board-certified nurse practitioner in family medicine. My certification allows me to treat clients from infants to seniors, but my focus is on adults. I own a medical wellness practice located in Clermont, Florida, where we focus on therapies to help clients improve their health and wellness. And we take more of a preventative, integrative, functional approach by getting to the root cause of a client's concern and treating clients with IV nutrition, weight management, aesthetics, peptide therapy, hormone therapy, and mental wellness.
Awesome. I love it.
Yes. Thank you.
So Michelle, let me ask you this. So when it comes to weight loss, we know there's all types of different fads and lose weight quick schemes and things of that nature. So what are some common challenges people face when trying to lose weight, or at least that when they come into your office, what are some of the hurdles that they face when they're trying to lose weight?
All right, so it varies across the spectrum. In the practice, we offer an individualized weight loss program. So the program outline may be similar, but it is customizable to the client based on their specific health condition or situation. So some clients have had problems with weight since they've been a child and carried on into adult years. Some clients have difficulty with hormonal imbalances, for example, the thyroid hormone or cortisol levels. Some clients voice they have barriers with poor supports at home, so they might be the one trying to change their lifestyle. However, everyone else in the house is eating fast food, for example. Some clients have physical limitations, for example, osteoarthritis in the knees or in the ankles, so they may not be able to go out and walk or run as much as someone else. So they may have to change the program so that they are doing non-weight bearing activities, for example, swimming. And again, that goes based on where they're located and what resources they have available to them. And some clients, it's just education and helping a client to change their lifestyle.
Awesome. Yeah, the lifestyle aspect is I think is very important. Understanding, it's not just the goal of weight loss, but do you want to identify yourself as a healthy individual? So, trying to think a healthy individual takes these steps, and obviously exercise, how you eat, and all these different other aspects roll into the habits that you create, right?
Absolutely. Stress management, lack of sleep. Some clients just really have a very poor relationship with food based on family, based on the environment. I mean, if you look at the US diet, pretty much every corner there's a fast food convenience place to eat. You can go to the gas station, you can anywhere you can get fast food conveniently. We're busy, busy, busy. We're on the go. It's cheap or affordable. Maybe it's getting a little bit more these days, but it's fast and quick, and that's what we're used to. We press a button and something comes out. We press a button, we get a text message. We press a button and the channel changes. That's how we are now.
So speaking on the diet or food habits, can you touch on the role that what you consume, your diet, your daily food habits play in terms of weight loss? And then if you have any practical tips for people that are trying to change the way they eat or create a healthy eating plan?
So I don't like using the word diet, because that connotates that this is something for right now. However, it does have its place. I prefer to say a healthy eating plan, or having a better relationship with food. But most people identify it as a diet. I try to encourage individuals to have a more healthy relationship with food, which takes time to establish and reestablish over time. A lot of behavior changes, a lot of substitutions. Over 50% of someone's weight loss journey, which I will call it, not just to reach a goal weight, but to maintain it, is what we focus on here. Is over 50% is what we pretty much put into our mouth. So you can exercise, but if you're not eating healthy, then that may offset all of your exercise activity. I'm sorry, what was the second part of the question?
So pretty much, if you had any tips for people that are trying to establish a healthy eating plan.
So I know we hear it all the time, and it sounds very cliche, but it's very true, that most of the time when we're hungry, we're really thirsty. We're not drinking enough water. We're drinking soda pop or iced tea, and it's water but colored, but it's not the same.
Not at all. Even close.
High content for sugar in there, additives, preservatives, etc., etc. Water is the best fuel for our body. It helps with metabolism. So clients that just may be stuck in a certain weight and they can't move forward, they really need to stay hydrated. In addition to not skipping meals. So when you skip meals, or when you kind of starve yourself, the body tends to believe that, I have to hold on to this, so I'm not spending it. So I always equate it to, if you have a job and you become unemployed, typically we're not spending as much as if we were employed, right? So when the income or the food stops coming in, we stop spending out, or we stop losing weight, or the metabolism slows down. When we have an income again, or you get paid, or you eat consistently, then we spend, and you also lose weight in addition to that.
Interesting. So are you not a advocate of intermittent fasting or fasting in general?
It has its place, and it depends on where someone is at in the program. Sometimes I may use it as a metabolism kickstart to overcome someone's plateau, but that is not sustainable.
Intermittent fasting, you're saying, is not sustainable?
Yes.
Gotcha. Okay.
I recommend pretty much a whole food eating plan. So pretty much the perimeter of the grocery store, and trying to refrain from what is in the middle of the grocery store. If it can spoil within 5 days, that's something better for you to eat. Also, if you make it at home, it is better for you to eat.
Agree with you 100%. And to kind of elaborate a little bit more on you explaining about being the water being very important. What I find is a lot of people are dehydrated due to what they're eating. So when you eat a lot of processed foods, a lot of meats, there's no water content in those things. So that's why you crave water or some type of liquid to hydrate yourself, even though, like you said, we know the sodas and all those have no type of benefit to you whatsoever. But yeah, the dehydration is a big thing, and a lot of this stems from, which people don't realize, is from what you're consuming. So I'm 100% with you on eating more fruits, vegetables, whole foods. So.
Correct. And if you're not cognizant of this, it's hot, you go outside, you go to the gas station, and you're thirsty. How many people are going to reach for water versus the big gulp?
Exactly. That
right?
big gulp,
The
yep.
sugar just sends a signal to the brain, dopamine, this tastes good, I feel good, I'm a little happy, and I have a little energy, and then it crashes, and then you reach for another one, and it's just a perpetuating circle. So
exactly.
It is not just one thing. This is a complete look at someone's lifestyle.
Right.
Yes.
A simple change, as in to increase your water or start to substitute, the Cokes, the soda, the juices with water. It's kind of crazy how big of an impact that could have on your health and your life.
Absolutely, especially in your digestive system. So you may not, some clients, say I'm not feeling hungry, or I'm not eating as much, not because they're trying to lose weight, it's because they're backed up as well. So
100%.
Not enough hydration can affect that as well.
100%. So let's kind of talk about the physical activity. So you kind of talked about it a little bit earlier, but how important is physical activity in one's weight loss journey? And if you could share some exercises or activities that you would recommend, and I know you touched on some of it based on what that person is dealing with, but are there certain ones that you prioritize or recommend more than others?
Not specifically. I encourage that we just start to move. So some of the clients that I have met have not been physically active except from the couch to the fridge, or from the couch to the door for DoorDash.
The DoorDash?
DoorDash. So, or Uber Eats. So let me, all inclusive. So for someone like that, getting them to even just walk around the block for 5 minutes is a great accomplishment for that person. For someone who is 200 pounds overweight and their knees hurt, even just to get out of the car, even if they sat down and watching TV and had an arm wheel to move their arms around, that is beneficial for them. Not everyone's going to run the 5K or the 10K. Cardiovascular exercise is great to build your heart health, stamina, and resistance training, or using your body or weights, helps to also burn metabolism longer. And in addition to that, it also helps build the frame. So when clients do lose weight, and depends on how fast they're losing, they will lose fat and muscle mass. So they'll lose the weight, but then they start to get a little floppy. And that's where you hear the concerns of, I wish I can tone this up, but you have to be doing that throughout the process.
I think it's important how you said you meet people where they are. Not everybody is the same, so you can't approach every individual as the same. And
Correct.
And that kind of leads me to something that you mentioned earlier, in terms of there's so many different factors, prior health history, right, that can also play a role. Is there any specific conditions that you see a lot? I know you touched on things like osteoarthritis, you touched on hormonal imbalances. Do you run specific tests for patients before starting a program, or is there anything that you see that would challenge a patient to go ahead and lose weight, and then how do you address that?
Great question, loaded but great. So first of all, we absolutely start with blood work. No client is seen without having blood work done. How do we know what we're treating, right? So in this person's treatment plan, are we just recommending weight loss medication? Are they diabetic? Do they have high cholesterol? Do they have hormonal imbalances that need to be corrected? Do they have nutritional imbalances that need to be corrected? From there, then we can design a individualized program that meets that person's needs. Some clients have a history, like what we said, of osteoarthritis or hormonal imbalances. Some clients have a history of mental illness. They can have a history of depression. They can have a history of substance use. They can have a history of trauma, in which someone may develop a poor relationship with food in order to compensate for that. Okay, so we can tell someone to exercise and eat this amount of calories all we want, but until you identify the root cause of that person's relationship with food, they will always struggle. So for example, I had a client I worked with for 6 months. I've seen her every week for 6 months. And it would be 2 pounds lost 1 week, 1 pound, back up again. And she had reasons, we can call them excuses, but she had reasons why it was a challenge for her. And one day she just bursted out crying that she had been sexually abused and she uses food to comfort herself. Okay, so she was referred to counseling therapy for her to work on that in tandem with this weight management program, because her poor relationship with food and her unhealed trauma is one concern, but at the same time, it's now a detriment to her health because she has diabetes, high cholesterol, high blood pressure, and she was only 30. So it's not just, eat less, move more, or else we would all eat the same and it would be the same for everybody, but we know that's not the case.
Again, going back to how we look at health, how there's different aspects. It's not just, the lab test, or it's not just how you feel, or just, the symptoms that you are expressing, but that emotional, that mental aspect, in order to fully get the results or breakthroughs or identify the cause root, you have to be able to address everything.
So yes, in the case where there are trauma or mental health concerns, I will refer a client to a behavioral health counselor. In clients where I do their blood work and I see very, very high levels of cortisol, that stress hormone is constantly going, will subconsciously direct a client to eat more, especially snacks, especially sugary snacks. So that just adds to the weight loss, or the weight loss barrier. So managing the cortisol level with, maybe I may recommend meditation, maybe I may recommend yoga or something, or something that they can do to help manage their stress or increase their physical activity. Depends on what they like to do, and everyone is different. In the case of hormonal imbalances, those also need to be corrected too. I can do that as well. It just depends on the client. If they're already seeing someone else, then they can reach out to another provider, an endocrinologist, to manage that, or I can manage that myself as well.
Absolutely.
Awesome. So,
and some clients I do actually refer to a personal trainer. An exercise guide is given to the client. However, if they don't have the motivation or feel unsure, then they may need personal guidance. So say, for example, you've never been to the gym before, you just walk in there and you look at everyone and you just, I don't know where to go. If I go to this machine, I have to read it. I don't want everyone looking at me, so they're just not gonna go. Yeah.
Right. No. And it's awesome that you are co-treating too. You don't really attribute co-treating with weight loss. You'll see, like, typically you'll co-treat if you have, let's say, you have diabetes, you may co-treat, or you have cardiovascular disease, you'll co-treat. But when it comes to weight loss, you typically, it's kind of like a one size fits all almost type thing. And so it's very cool that you're doing that. You're reaching out to other providers that could benefit the patient based on what they're dealing with. So, but I want to stay with this patient though. So, and you don't have to, devolve any information, but let's talk about some goals. So when it comes to setting goals for someone to lose weight loss, how do you go about that? And if you can use that patient, I don't know if she had a certain goal other than maybe losing weight, but.
So she just wanted to be healthy. She just said, I want to be healthy. I don't want to end up like my parents. They have X, Y, and Z chronic illness. I don't want to take 15 pills a day. I don't want to go to the doctor every month for an appointment. I don't want to do that. I want to be healthy. I want to have a better relationship with food. I want to feel good about myself. Okay. They had a second job where they had to be in the public eye, and they were not getting the opportunity for those positions because of their weight. So honing in for that person what their motivations are helps to keep someone accountable and helps with goal setting. Okay, so putting back into perspective, why did you come here today? So those weeks where you fall off or there's a distraction or something happens, remember you wanted to attend this event. Remember when you see your primary care doctor in 6 months, you want to discuss getting off of or decreasing your doses of these long-term medications, for example. Or you don't want to go back to the store and buy more clothes, right? You want to stay with the clothes that you have in your closet. So setting realistic goals in their language, not mine according to a number on a sheet of paper. Yes, as a healthcare provider, those are one of the things that I look at, but I also mesh it with the client's personal goals as well. So for example, BMI or body mass index is just one tool that we use in the weight loss world, but even football players are considered obese and they're not. So they have a lot of lean body mass. You also take into consideration a person's weight. I mean, their ethnicity as well. So not everyone fits into that BMI box, but it is one tool in the toolbox, but that's old. We're not doing that anymore.
Yeah. So I wanted to also ask, when you're working with, patients, there's people that come across and hear stories of, I've dropped 50 pounds in 2 months, or something crazy like that, right? Is there ever a concern of rapid weight loss?
Yes. So generally speaking, between 1 and 4 pounds a week in my program is healthy. Okay, depending on the person, depending on what they're doing, but generally between 1 to 4 pounds a week. If someone's losing more than that or has lost a lot of weight in a very short amount of time, that could lead to arrhythmias or heart problems. It can lead to nutritional deficiencies very quickly. That can also lead to another poor relationship with food where someone doesn't even want to eat and can develop another type of psychological disorder. In addition to that, rapid muscle loss. So you'll see the person lose weight, but they have no frame, right? They're just floppy, for a better word, for lack of a better word, right? So you can see the weight loss, you can see the sag in the face, you can see the loss of collagen when you lose weight too quickly.
So what would you say to those people that can't seem to lose weight no matter what they try?
Make an appointment. So yes, that's one, but that's B. So A would be, again, a thorough assessment as to that person's health history, what they've tried, what they haven't tried, how long have they tried it. A thorough history will get the ball rolling as to what to do next. And in addition to that, a good set of labs. Also, they're looking at their medication list. Some medications can make it harder for someone to lose weight as well. You have psychotropic medications, which clients have to be on for example, for mood disorders or schizophrenia. They just have to be on it. So to offset that, they may have to curtail what they eat or be more physically active when they're taking those types of medications.
So there's so many factors that affect weight loss. There's so many. So it's not just about, you know, losing the weight, but treating the whole person, trying to be as healthy as possible, because we're all we're designed to be healthy and express 100% health. And, you know, I think it's an awesome thing to approach, you know, weight loss with that aspect. For those that want some information or want to contact you, can you just share everybody again the best way to do so?
Sure, thank you very much. So our office is located in Claremont, Florida. We see clients in the office or virtually across the state of Florida. We offer all of our clients a complimentary consultation, which could be in office or virtual, and that allows us to discuss a little bit about their needs and how we can possibly help them. Our phone number is 352-388-7075, and our website, which is under construction, is footsteps2towellness.com. And we're also on Instagram and Facebook at footsteps2wellness.
Awesome. And we'll go ahead and link those in the show notes below. Awesome.
Yeah.
Well, as always, guys, thank you for tuning in. Another episode of Nuwave TV.
Yes, and thank you again, Ms. Hylton, for taking the time out, and you're giving us incredible insight to your process and how you deal with weight loss.
Thank you very much for this opportunity and this forum, Dr. E and Dr. Brown, and we will be in touch again soon.
All right, guys, thank you for watching.